I'm sorry, you guys. The maid had just came. I mean, of all times. But as I was stating, there's just so much detail. But what I did want to come to you and let you know that this was the most intense surgery that I've experienced. I just had my breast reduction surgery. I probably took the Norco maybe for 2 days. After that, I just took the Tylenol. I didn't even have to take it on that like that. The first surgery, I did take all of the medication they give me, but they only give you like 15 pills to begin with. It lasted probably the first week, but then after that, I was fine. I was outside washing my car by hand on my own after my tummy tuck a week later. So I'm not saying that probably next week I won't feel good with this, but I've never been so down. I've been so down with this surgery, having a lot of pain, a lot of, what do you want to call it? Incapacitation, which I am not accustomed to. First time, now I understand what some of the girls have been talking about. Is all that I can say. I'm gonna go ahead and lean up because, like I said, I know I'll be wanting to see results. I ain't trying to just see nobody's head, but I've already come down 1 inch from what I had measured before. So when I first weighed, I had measured myself before I left the house. I have my compression socks on, anti-embolism socks, but so when I left the house, I measured around here, around this part of my waist. I measured 34. Right now around here is measuring 30, 33. So just the procedure in itself went down. This went down 1 inch. When I measured around my buttocks area, completely around here with my measuring tape, I was a 43. I am now almost a 49 when I measure around here. So major improvement. This is the first time that I've had any surgery. I mean, well, my breast reduction, I could see my results immediately. But from the liposuction I had 6 years ago and the tummy tuck / liposuction that I had with a supposed BBL 7 months ago, I could not see results. On my tummy tuck, yeah, I could see results. But what I'm saying is, as far as looking like I have a smaller waist and all of that, like I could see that immediately from this surgery. You know, we've been trained, and I've heard everybody say like, oh, you can't see results in the beginning. I'm seeing results in the beginning. Now, let's come the second week, I start blowing up, swelling up for some reason, more than what I've been doing this first week, and something changes, I immediately can see changes. I measured out the changes. There's changes. So kind of in a way, I'm thinking when surgeons are like, oh, well, you can't see your results because of swelling, that. It's just a way to say, so you don't question them why your results don't look right out the gate. I'm sorry, my results look right this time out the gate immediately. There is no reason you have to wait 6 weeks to see what your results really look like. And with how I look right now after this surgery, that like I can't even believe I was believing the doctors, because guess what? The 6 weeks go by, the 3 months go by, the 6 months go by, and guess what? You still not seeing the results. How you trying to see the results? You should see some level of results immediately after surgery. I don't care about swelling or none of that. Now, I did get the lymphatic drainage massage. I just think that has a lot to do with it. When I had my tummy tuck, they put in those drains, took them out a week later, closed up the holes, and I was so swollen and bloated. The best thing you could do is actually push that fluid out of your body. Right now, I'm not a doctor, surgeon, any type of medical professional, but in my head, with my experience and how good my results are already, I'm wondering why any surgeon will want their patient to withhold that fluid. Yes, your body will naturally process it, but why would you want it to go through a whole 6 months trying to process all of that out? or a whole year trying to process all of that out. Like, it's crazy. Like, when I had my tummy tuck, I was never down. My waist didn't ever get small or nothing. I still was having, you know, swelling. If I eat something, yeah, I would still get the swelling. But what I'm saying was, I never experienced it being way down. I don't know. That's just my personal opinion. I don't know why any surgeon would want a patient to have to come and say, I don't see results. Y'all, they should be promoting getting that massage, getting that extra fluid out of you, because you will see results once you're getting help getting that fluid out. And you're going to know what you're going to look like afterwards when the swelling does actually stop swelling up, you know, over time. Man. You know, like I said, there's so much to be said, but I just wanted to bring you something. There's so much to be said because I really want to give a rundown from this happened first, second, third, fourth, fifth. I really want to give you a rundown like that, but I don't have the energy to get into it like that. But I did want to bring the two most important things is, number one, you can see results immediately. If the doctor really clean that fat out like he's supposed to, you get those drainage massages like you're supposed to, you're gonna see results immediately. There should no way you questioning like, oh, come to me, I look like what I looked like before. Because if you question it, believe and trust what you're seeing with your eyes. Because I swear, I don't know how many times doctors have told me, oh, you didn't wait long enough. Oh, you're not going to see nothing until 6 months got to go by before you going to ever know what you really going to look like. Like, no, that's because you're doing shoddy work is why you would tell somebody something like that. Because you can see results immediately if the doctor is good at what they do. And like I say, follow up and get all of that extra pus and all that stuff accumulating in you. You will see results. You ain't going to have to question. I didn't have to question nothing with this surgery. My doctor did that. He did that. He know what he doing. I'm telling you. But that's all I'm going to go into right now. And like I said, when I come back to you, hopefully I have enough energy, like I say, to give you a play-by-play from day one, what happened on surgery day, how I felt, everything. Like I say, two most important things. It hurt the most of any surgery I've ever had before. Definitely. I'm not saying that to scare you away. It just lets me know, like, he really did some work them other doctors didn't do. I wouldn't be coming back had the other doctors did what they were supposed to do. I wouldn't have to, because this wouldn't be a third time, you know, trying to get a small waist. It doesn't make sense that them other doctors is not doing what they should be doing. They don't know what they're doing. I'm sorry. There is no way in the world that you can actually do what this man did today, and you doing less than what this man did. You don't know what you're doing. Nobody should have to come home from spending this kind of money and have to come home and be like, I'm waiting to see results. Like, it's not right. It's not fair. No doctor should feel confidence within themselves. They shouldn't feel good about themselves or the type of work they do when you have to have patients come back and say, well, I'm not seeing my results. And then they want to come and shoot you back with, oh, because you're going to swell for 6 months or you're going to swell for a year. No, but I should still see. I shouldn't have to question, are there really any results? You know, right after surgery. Like, I mean, I don't know. That's, again, how I feel about it. Now that I got the real deal, right, I know now. Yeah, doctors that's talking about wait a whole 6 months to see a result because you're questioning why you look the same or why it don't look how whatever. It's because they didn't do the job good. Period. But okay, I'm going to see you guys later. Peace out. I'll check back in with you. Thank you for watching. Please like, subscribe, thumbs up, thumbs down. And I will talk to you guys later.
And make sure to stay tuned for more.